Very good afternoon, one and all. Respected Dr. Bhuvan Nagpal, thank you for giving me this opportunity to give a lecture on a topic which is very essential for all the undergraduates who are listening to this lecture. I am Dr. Manish Bhargav, professor and head from the Department of Oral Pathology, Manav Rachna Dental College. I'm sorry, this is my first time on an online sitting, so I might fumble. So if at all you have at the end of the lecture, please feel free to ask me any question. Now, before I start, I want to pay homage to my parents and my loving family who's been ever supporting me for all my endeavors. Now, this presentation is specifically tailored to the current Indian dental education scenario for all our students. Now, the different challenges, the curriculum, and the aspirations of a typical Indian BDS student, we have to understand as a student कि system में हो क्या रहा है and why are we getting so scared? Why are we not taking things seriously, and especially oral pathology, as a subject. So this lecture is a comprehensive overview. One, that why is it important? Second, how do you go about with it? How do you train yourself? And lastly, most importantly, you have to believe in yourself, that yes, I can do it. If you don't believe it, you can never do it. So now, when I were discussing with the topic that what should I give, like it's been almost 20 years in education, in teaching, and I have taught more than 2,000 undergraduates in my career. And there is something that I found which is similar to all of them. They were very afraid of this subject. And why were they afraid? Because they thought that it's a full jargon of different lines and different things, and it gets very complicated. So many classifications, so many lesions which almost look alike, and especially the histopath. Oh wow! So I thought how to, we've been discussing with a lot of people and a lot of colleagues, including Dr. Bhuvan, that how to make things simpler so that a student can get involved that and understand the importance of the subject and how he can master it. So now, what is the purpose of this subject? So this basically connects you directly to the purpose of your education or the reason that you entered dentistry. First, that it is, you have to understand that it is not just an exam topic. Normally in school, that when we are studying any subject, we just want to get some good score and just get over with it and then move on to the next classes. No, medicine and dentistry is not like that. Whatever you study in the first year or your second year will keep coming back to you in your final year. And it's not just the education, it will keep coming back to you throughout your life. So you have to keep revising, keep getting into it. And that's how you get mastered, because you're a professional. You're supposed to know everything. So please remember, first and foremost, it's not just an exam topic. It's not something you just want to pass and get over with it. First, very important is early detection. Today we live in the times of where prevention is better than cure, and then we are accountable for anything that we have missed. So sometimes, as a healthcare professional, you might be the first person. A patient might just come to you and just randomly talking to you that I've been smoking, and you happen to see a small lesion in his mouth, a white colored patch, or maybe an ulcer, which is absolutely painless, and patient is completely, asymptomatic. But you might be the first person, imagine, that to take him, convince him, get it evaluated, and it turns out to be an oral cancer. And early detection, treatment is conservative, so you happen to save that person's life. Imagine the kind of high or happiness that you will get and the blessings you will get. That's the most important thing from that person and the patient and his relatives. Second thing which is important is diagnosis. When we don't know what we are, how will you manage something when you don't know what you have to manage? For example, if I give you a dart board and you know that there are different circles and you have to hit a dart, so you know that this is the bullseye, that it's in the center. But suppose if the area is darkened, now suppose, and then I give you a dart and I ask you to throw it at the board, would you be able to do it? Because you're blind, you're just hitting anywhere. So, but if you're accurate, if the lights are on and you know exactly where to go, your dart will hit at the spot. So that's where accurate diagnosis comes in. If you know and you understand the subjects, and if you're able to diagnose it properly, you will be able to treat it properly. So you, as an undergraduate and as a oral pathologist, become a very important link between the final management and the initial diagnosis. So now, step one, how do we achieve our goal? How do we become proficient? How do we become accurate? So first step for anything is a strong foundation. You might think Burj Khalifa or Qutub Minar or Eiffel Tower, or for that matter, any monument which has been standing for more than 20 years or 30 years, even the houses that you stay. I mean, like if you're living in a house for more than 20 years and you feel safe. Why? Because you have a strong foundation. The base has to be strong. If your base is strong, only then you can succeed. So now how do we make our base strong as far as dentistry is concerned, as far as lesions are concerned? First, you need to differentiate what is normal and what is abnormal. So now where do we study normal? We study normal in the first year or the second year. So if you don't understand what is normal, you will never be able to appreciate what is abnormal. जब सही नहीं पता तो गलत कैसे पता लगेगा? Then second thing, remember the pattern. Don't just memorize it. मतलब रट्टा मत मारो कि look at the changes that is happening. Like for example, when we say Wickham's try, now you have to think here Wickham's try lichen planus में होता है, white lines आती हैं. Why are they coming? They are because of the T cell mediated immune response, which is causing the liquefaction degeneration of the basal layer. And that, so you understand the pattern that what is happening. So you have to understand why, and then what becomes much easier to remember. Please do not cram. Oral pathology is an understanding subject. It is not a ratta wala subject. It is not something that you can cram. Okay, it's not mathematics that you like keep cramming two by two, two into two is four, two into two. No, it doesn't. You have to understand the basic concept, make a flow chart in your mind that what is the cause, what is the etiology, what is the pathogenesis, then what after the pathogenesis, what are the clinical features, from the clinical feature, what does it look like in the tissue level or the microscopic level? And based on that, finally you come to a diagnosis and then comes the management. Now, what happens in a routine day-to-day practice? I mean, like when you go to the clinics or when you see dentists working, a lot of people do that, that they just jump on the thing what they see and directly go on to the treatment. We don't spend time to talk to the patient and find out what was the reason that he ended up in this situation. Why is there a big hole in his mouth? Did we even ask that, okay, why that he says that all my teeth are very bad and they're all caries, and then you have another person whose teeth at the same age, same locality, same environment, he's absolutely fine. Why that difference is there? So you have to understand, maybe his diet was wrong, maybe he's not taking care of his oral prophylaxis, or can there be something else? And this is where oral pathology comes in. This is where your basic comes in. Maybe there is a defect in his enamel, maybe there is a problem in his dentine, and that is why he's more prone it. Or there may be some problem in the salivary glands. So there is a decreased amount of saliva, which is like our most protective thing against dental caries. So you have to, correlate those things. So first step is very important. That is, you have to build a strong foundation. Now, sometimes, as we are going ahead, we get embarrassed कि यार मैं first year दोबारा क्यों पढ़ topic क्यों पढ़ूं. Trust me, even after 21 years or 30 years, any senior professor you for his class is going, he will always go back and see maybe just for 2 minutes. So revision and recapitulation is the key. You know, we all want to do root canals. Now, to do a successful root canal, recapitulation from going to a bigger file, you have to go back to the smaller file, and that's your treatment of success. So that is where you need to be very, very careful. Now, once you've got our foundation strong, so now what do we do? What do we go? So now we go on to the learning strategies. अब हमें समझ में आ गया कि ये नॉर्मल है. अब हम इसको abnormal से कैसे कोरिलेट करें? How do we remember that? How do we correlate that? So first, clinical correlation. Now, no, as an oral pathologist or as a subject, most people think that it is just seeing the pink and blue. That's the slides that you normally see, and then you come to a diagnosis. No, unless we have a clinical correlation. Now, that is a golden rule that you cannot come to a diagnosis unless you clinically correlate. So, when you see a case of denture stomatitis in your clinic, in your practice, or in your as a student in your in your pre-clinic or wherever you're seeing, please go back and read not just about denture stomatitis, read about candidiasis. Can that fungal infection lead to the situation? Just don't go randomly and trimming the denture because the patient says that he's feeling a little bit of stinging or a burning sensation in his mouth. When you study about periapical abscess, imagine the patient that had come to you with that swelling and maybe a little bit of pus discharge. Connect what you read in your book to your clinic. So always remember, use your eyes. Always think when you see the patient, that image should be there in your back of your brain. So whenever you're reading, correlate that image. So the moment you see and correlate, it's always more impactful. It is always better to understand and learn. So you will never forget it. Second, sometimes, I mean, like, of course, we are not Picasso that we are very good at drawing and all. You can just sketch. I mean, like, nobody is expecting you to remember and, make it very, very perfect. Even in your exams, you take about 3 minutes to draw the diagram. So in 3 minutes, I'm sure nobody can make a amazing or a very good looking. So it's all right. We also understand it. But when you draw it, you can correlate things, whatever is in your mind. You can only draw what you see and what you remember. You just cannot, if I say draw a car, so you would know what a car looks like because you've seen so many cars on the road, and then you will be able to draw it that, okay, fine, it has a hood, it has a roof, it has a tail, it has two or four tires or roof or doors, whatever. So now because you have seen it, you can sketch it. So similarly, when you see something, try to correlate it clinically, try to correlate histologically. Then sometimes we need to create some mnemonics. Now, mnemonics is very easy to create. You can make your own. You can be as creative as you want to be. For example, if I say Sjogren syndrome, this is something which I use in my class also. And at least in my time, it was very common. We say DRC. So DRC can be dry railway compartment. So dry stands for dry eyes, R stands for rheumatoid arthritis, and C stands for lymphocytic or infiltration or the curious part of it. Similarly, you have in lichen planus, there is a syndrome that's associated. Uh, think about it. One, two, three. I'm sure 90% of you don't remember. I'll give you a hint. It has DHL. That's D stands for diabetes, H stands for hypertension, and L stands for lichen planus. So now, what is the DHL? Now, DHL is like in my time, it was a courier service, but here it's a part of Greenspan syndrome. So now you can create these mnemonic, you can make your stories, you can make endless things, whatever is comfortable to you. But you should have your own this thing. You don't have to follow mine. If you find something else, something which you can correlate, please go ahead. But the end result is you should remember that a lesion has these sort of these sort of signs that we need to understand. Then we all have friends. You know, there's a saying, keep friends close and keep enemies closer. But when it comes to education, please keep your friends close, because they're the ones when you go to the coffee shop, when you go to the dining shop, when you go to partying, when you go to just maybe in the car or in the bike, you can just talk to each other in a candid way. You know, majority of the learning, in fact, a small funny story that when I was doing my third BDS, that is in 1997. So the first thing when I finished my oral pathology, I said I'm not going to open up Schaefer again because I was so tired and so drained. This is like an honest confession, so drained of subject because nobody told me how to go ahead with it. That what is it going to do? What is the impact it is going to have in my life when I'm treating my patients or something? So now when I left it, then it was a very difficult phase. And then ultimately, when I started practicing and where I would get stuck, I had no choice but to open it again. And sometimes just think about it. Sometimes when you're stuck up in a situation, what do? We all play Kaun Banega Crorepati. We phone a friend. We ask कि यार ये हो गया, can you please tell me क्या हो सकता है? Now that can be as simple as understanding the disease or the diagnosis, or even coming to a treatment plan, or even helping in treatment. We call consultant, we call our friends for different sorts of managements also. So study groups is the best way to learn. Please form as many study groups you can. एंड स्टडी ग्रुप का ये मतलब नहीं है कि सारा टाइम पढ़ाई पढ़ाई पढ़ाई. नो, गो हैव फन, टॉक अबाउट एवरीथिंग, टॉक अबाउट योर टीचर्स, टॉक अबाउट एनीवन यार. बट द पॉइंट इज टॉक. The more you take it out from, the more confident you will get. Then the third component of proficiency is using the resources. So now what are the resources that are available in our vicinity? Now the first and the most important, that in today's time, I mean, like in my times, the only resource we had was books. So even for a small article, we had to go maybe come to Ames and get it xerox and go back. But now, thanks to the internet and the different platforms that we have, it's so easy, even whether it comes to slides or microscope, and of course, YouTube. YouTube rocks, correct? So YouTube, you get everything in today's time. So use those atlases and platforms in different ways that you can to improve yourself. Not just watching, even Instagram, Instagram is not bad, provided you use it in the right way. Instead of watching other people dancing or doing something, you start watching people doing their work. You it'll be surprised that you have a dancer and you see the or somebody is advertising for some food or some cosmetics, and you'll see some thousands and millions of followers. However, if you see somebody teaching or somebody doing a perform, you will have few hundreds of them. That's the irony. We don't go to the right things and we follow them, but we want to go for something which is more let's say glamoristic. So cut the glamour, get into this, use these digital formats right now. With thanks to AI coming in, AI has made our life even more easier than what it was. So you can use that. There's no harm in that. But get your concepts right. Second, your faculty. Now, this is a controversial thing. Sometimes, you people just don't like their teachers for whatever reasons. They're not confident, they're not comfortable in talking to them. uh, Personally, let me tell you, as a student, as a teacher and a student relationship, when student comes to me, they are very scared. They're very intimidated because I come from a defense background. So I have been always, been very disciplined. And that I feel discipline is something that we shouldn't compromise. And it takes us in a long way if we are disciplined in our life. So that is one thing that I try to inculcate. And because of that, I'm always mistaken as being very strict and very firm. However, the moment they see the difference after 3, 4 years, probably they become one of my very good friends. And we talk over, tea, coffee, and we go for vacations, everything. So we as your faculty, we are there to help. We are there to support you. We are not there to make fun of you. Please don't, even if there is something, कोई अगर हंसी मजाक हो जाता है, so don't find it insulting. Please don't go to now, in our days, we never heard of things like stress and anxiety and depression. We all are scared. Even I am scared. Initially when I started this lecture, because it's my first time online, even I was a little restless. It's all right. It's not the end of the world. Believe me, just relax. You'll be fine. And if there is a question, it might be as stupid or funny or weird you might think, please go and ask. ज्यादा से ज्यादा क्या होगा, हंस लेंगे, और क्या होगा, they might say we don't know, they might say you go and read, और क्या होगा, but at least get it out of your heart. If you have it in your heart, please speak it out, because that is very, very important. There is no harm to asking the right questions or even the wrong questions to the teachers, because we are supposed to answer that. That's our job to do it. Then, lastly, the most important when you're talking as a clinician, as a professional, your patients. They are your best teacher. They will come and tell you. So whenever a patient comes to you, please don't think of it like a commodity कि वो मुंह खोल के आया है and you just do your job, move shut down and say get out next. No, it doesn't work like that. Please spend some time with him, and you believe me, the things that you will learn are amazing just by a candid conversation talking to your patients. You can easily correlate. For example, I say somebody comes to you with multiple carious lesion. So you're just talking to them, and in a normal way, and he says कि जी मेरे पे cavity आया है, and that's the reason that he's come for. You say fine, you take an X-ray and you say okay, this many tooth will require fillings and this might require a crown and all, and then you just casually ask, that what happened, how you're not brushing, you come from a decent background and everything, and what happened, you don't brush properly. He said, no, no, sir, I brush twice a day and I use Colgate, Pepsodent, blah, 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 whatever. But yet you see, okay, there's something wrong. And then he says, actually ना आजकल काम में बहुत stress है. I'm not able to remember things very clearly. I'm not sure that I'm eating well, and maybe I'm not. And then your leading question is, अच्छा खाना पीना तो ठीक खाते हो? So he says नहीं नहीं पानी थोड़ा आजकल कम पीते हैं. So now you correlate, okay, he's been having less water. So maybe he has a little bit of dry mouth, and the food which he's having because he's of his work pressure and all. So there is some psychological distress the patient might have, and because if he's doing a lot of binge eating, during our exams, we tend to eat, right? So even the patient, if he has some work or something, a work pressure, so he's eating a lot of, and the best thing when you are under stress, we all love to do is eat chocolates, right? Eat sweet because it releases dopamine. It helps us to get that feel good factor. So that's how the nutrition or the department came up with chocolates. So that's why we all get addicted to chocolate whenever we are feeling a little bit low. So so you correlate, okay, fine. So he has a psychological distress. So because of this, so then you refer to him to a psychologist for an opinion. Not that he's mad or something. Maybe he needs help. And that is where you understand that, okay, that there might be some correlation. This is just one example that I'm giving. I see so many, some of my friends that I go to in their clinics, they don't call me a dentist. They call me a dental doctor. Why do they call me a dental doctor? Because I sit with the patient. I take about half an hour, 40 minutes, just listen to him. I ask him, tell me everything about whatever you have. And that is where you come to the correct diagnosis, because they are going to tell you the story. They're going to tell you the condition they are. So you have a live case in front of you. You have to find out the different clues, connect the right blocks, and then come. A lot of people have GIT issues. A lot of people have loss of taste sensation. When you will be surprised, they say they're not able to enjoy their food. They don't have a good taste. And you are surprised, you're talking to them and everything. And then you just casually, candidly find out that okay, he has some GIT issues. Now, what happens with GIT issues? So obviously there is malabsorption. So because of the malabsorption, he might be anemic. Because of the anemia, he might have. So there's a correlation. वो जो एक chapter है oral manifestation of systemic diseases, not very relevant in our this thing. कोई पढ़ाता भी नहीं है और कोई पढ़ता भी नहीं है. But believe me, the moment when you come out, no, just go through that chapter. How diabetes is very common in our country. How diabetes correlates with different oral conditions. All those things will be correlating. Now, so we've done the three components which are required, three simple steps. So we have foundation, then we have correlation. Now, what happens नेक्स्ट सो जो हमारा डर था अब वो डर कम हो रहा है क्योंकि जब आपको पता लगता है यू फील सो हैप्पी दैट ओके यू नो दिस इज अ वेरी फनी स्टोरी that there was a student who goes and he sees a patient and there was a case of leukoplegia which was very aggressive. So he goes running कि मुझे पता है कि नहीं नहीं ये वो ल्यूकोप्लेकिया नहीं है ओरल कैंसर है पक्का ओरल कैंसर है and we are like okay fine and then there's a biopsy being done and that biopsy turns out to be a well differentiated squamous cell carcinoma. And the joy, the student was like always behind. He said, first thing, first diagnosis, I need to know. Now he was very happy to know, but in my heart, I was feeling very sad for the patient. कि भैया ठीक है, आप बच्चे को बड़ा खुश हुआ कि उसने जो सोचा था वही निकला. Because he took the history well, he clinically correlated it well, and then he wanted to confirm it through the slide. So all three things went in right. So now he knows that it is old cancer. So he said, I said, now what are you going to do? That is where the question mark comes. So then he said, sir, oral cancer, he has to be referred to the cancer institute. And immediately he has to, I said, yes. So, once you diagnose it and you identify the lesion, you will have exactly, know that what has to be done. Now, when you take a radiograph and you see a radiolucency at, let's say, an impacted tooth, so you know that there is a story, there's a unilocular lesion in a mandible, let's say, of a 30-year-old. So what do we think? We start thinking of odontogenic keratocyst or an ameloblastoma. So when you come to a diagnosis of OKC or ameloblastoma and immediate management, so exactly it just gives you that confidence that okay, fine, that what my thought process was correct. So this confidence that you get is incredibly empowering. It gives you that instant high ki nahi, yes, I am right. So this is where it transforms you from a student who is just passing to a very competent dental professional. So please remember this, a student who is just using the education for passing versus to a student who's a competent dental professional. Now, once you become competent, you get respected by your patient, you get trusted by your patient, and by your fellow colleagues also. So that is where the friend part comes in. So that whenever you're in trouble, the friend will be called. So you become a specialist. So this is that ultimate reward of Khud par bharosa, self-belief that yes, I can do it. So this is the thing that we've been always wanting to be, right? So now what do we do? इतना हो गया, इतना ज्ञान बांट लिया, करना क्या है भाई? So first you have to reframe your mindset. You have to think oral pathology is not a hurdle, it is not an obstacle, it is just an amazing jagran of different clues that you have to come together, you have to place together, and you form this beautiful, we play as a small child, we play this puzzle, right? Whenever we if you want to give any birthday gift to a 4-year 5-year old and you go to a toy shop, the first thing he'll give you a puzzle, because from that age 4 5 years age group our mind is getting tuned to unsolve all these puzzles. So pick one topic, master it, understand every aspect of it. It can be as simple as dental caries or it can be as complicated as squamous cell carcinoma. Link it to its causes, link it to its etiology, understand the pathophysiology, why is it happening, understand the different histological grading, why the histological grading, how is it clinically relevant. Suppose there's a well differentiated carcinoma versus a poorly differentiated carcinoma, does it have the same treatment? Probably not. Suppose it's a dentigerous cyst versus an ameloblastoma, does it have the same treatment? No, it doesn't. If it can be a aphthous ulcer to a herpetic ulcer, does it have the same treatment? No. So just try to, master the story, understand the story. that what is happening. Take the clues, unsolve the puzzle. Then, lastly, trust your own ability. You have done an amazing job. Trust yourself. You have gone through school, you've done really well, you worked through your all the subjects in school, then you went through NEET. Oh, let's not talk about NEET. So you cleared your NEET, and that is why you got. If you were not clear, believe me, you would not. And there are thousand, I mean, like this year stats, I think there were about 16, 18 lakh people who had cleared NEET, who had appeared for NEET, and about 12, 13 lakhs have managed to clear. So there are still 4 lakh people. So you are amongst that 12 lakh people in the entire country. So feel proud of yourself. Don't, irrespective of your score, maybe whatever happened, happened. But trust, you have come over this challenge and then you got into a dental college. Now, this is just another one of your capable conquering, quest. Start building belief in yourself today. After this, if you happen to hear this, I know, I mean, like it's an online thing, so I don't know if you're seeing or not, but please start building belief in yourself. Start trusting yourself that you have the intellect, you have the diligence. Just trust it. To end, I leave you with this thought that the expert in anything was once a beginner. We all start, we have to start, just start. Everybody starts at a scratch, everybody starts at zero. You can't reach 100 if you don't start. Trust yourself, trust the process, and you will do well. And above all, have self belief. खुद पर भरोसा रखो, जीत तुम्हारी ही होगी. Thank you all for being here. Thank you, Popma, for giving me the opportunity. This is Dr. Manish Bhargav signing off. Thank you.